Hey everyone, welcome to the Ex-Wives Lounge podcast. I'm your host, Lauren. Today I have a really special guest on. He's not only very, very educated in his field, but he's also a friend. Mr. John Dawson. He's a doctor of chiropractics, nutrition, holistic supplementation. He does it all. Welcome to the podcast.
Thank you. Thank you for having me.
Thanks so much for joining us. I really appreciate it, making time for the lounge.
Of course. Glad to be here.
So, you know what this podcast is about. It's pretty much women empowerment and all of that, but I can't stress enough how health and wellness was like my motivating factor through the healing process of my divorce. And the thing that kind of propelled me through all the hard times was relying on health and nutrition, supplementation, whether it be for stress management, sleep management. And so a big reason why I wanted to have you on the podcast today is being a doctor in chiropractics, acupuncture specialist. I know all those things play into stress management, sleep management. So if you could educate the viewers and the audience a little bit more on your background first and foremost, and then secondary, just let's jump right into how your work can help with stress in the body, inflammation in the body, and all those good things.
Right on. Okay. First and foremost, I am a doctor of chiropractic, and I also have a master's of acupuncture and oriental medicine. And then I've done postgraduate studies in functional medicine, where I analyze lab work and from there provide dietary and supplement protocols in order to improve lab work.
Right.
I love that because it gives my patients another option, a natural way to be able to approach the cause of their disease versus just managing symptoms. But also we can work in tandem with their medical practitioners as well to optimize their health and at the end ultimately be healthier.
Right.
So that's kind of my passion and goal. I'm also a cancer survivor, so I have my own health story.
John, I did not know this.
Yeah, at 16 months old, I was diagnosed with leukemia.
Wow.
And so that gave me a profound just respect for the body's ability to heal, regenerate. And so that's kind of also what gives me my inspiration to help others. Right. And that's kind of my background and where my passion comes from. And when we start to talk about stress in the body, in particular, we know that that's a part of your nervous system called your sympathetic nervous system.
Right.
It is a stress response, but it's an adaptive response, right? So if we're being chased by a tiger, right, we need to be able to fight or run away.
Right.
But then there's also the other side to our nervous system, the autonomic nervous system, which is parasympathetic: rest, digest, repair, recovery, growth and development, reproduction, right? So if we are in that chronic fight or flight, it's going to throw all those other things off, right?
Because they all work as a team.
Exactly. It's a balance, right? So when it comes to chiropractic in particular, I love how chiropractic can improve stress in the body in particular. So chiropractic isn't really about just cracking bones, right? Or popping bones, the pops or clicks. It's more so about making a positive stimulus to your nervous system to improve function and overall health. Okay. So when it comes to stress in particular, we look at the upper cervical spine, and with proper adjustment or stimulation there, we see a reduction in stress. We see a reduction in blood pressure. We see a reduction in inflammation and irritation to the nervous system locally in that area, but also globally throughout the body.
Wow.
Okay. It's part of that parasympathetic area of your nervous system. So many people don't know that in the upper neck and lower pelvis are where the nerves go for that parasympathetic to calm things down. So even a lot of kids on the autism spectrum, I will adjust those areas only.
Wow.
Versus the sympathetic portion of your nervous system is between T1 to T12. Okay. So that's in like the mid back area where all the vital organs, the nerves are coming out and going to those vital organs as well.
Right.
But that area is going to help stimulate that stress organ to push cortisol, norepinephrine, epinephrine to give you that fight or flight so you can fight or run away.
Right.
Okay. So when we are adjusting the spine or any joint in your body.
Right.
It's really stimulating your nervous system in order to promote that proper function.
That's really interesting.
So, yeah.
I never knew that.
Yeah. And then when we come towards acupuncture, acupuncture is phenomenal. I mean, when it comes to stress management, anxiety, depression.
I've heard it actually helps with like reproductive.
Yeah, reproduction.
I know a lot of girlfriends, I've had a hard time getting pregnant. And yeah, they stand behind acupuncture for helping them become more fertile.
Yes. And it's amazing because with acupuncture, you're not taking anything away from the body.
Right.
Right. But you're really creating a balance and harmony so things can work and function better.
What exactly on a deep level does acupuncture do?
Yeah.
When you insert, what does it actually do to the system?
Yeah. So obviously in Chinese medicine, or, back in the day in traditional Chinese medicine, they didn't talk about, your nervous system, your circulatory system, your lymphatic system in those ways, but it is stimulating your nervous system.
Okay.
Right? So it's going to the subcutaneous tissue, but there are nerve endings there.
Right.
And we see the connection externally and internally to the organs in traditional Chinese medicine and acupuncture. So there's things called channels or meridians that can travel throughout the body. And on the surface, these channels go, and we're kind of tapping into those areas with the different points.
Got it.
Okay. And so I kind of liken it when it comes to pain in particular, kind of like a highway, right? You have traffic flow of cars. When there's a traffic jam, it creates friction and it reduces the flow of traffic.
Right.
Same thing in the body. In those channels of meridians, there's something called qi, which is more so not just energy, it's like the essence of the body.
Okay.
And so as we place the acupuncture in those particular points, it will kind of tap into that qi flow, improve circulation of the flow of the qi, attract healing energy to an area, and bring that balance and harmony. Okay.
Wow.
So that's kind of what's happening, but more so, like I explain it to my patients, we are stimulating the nervous system. So we're stimulating the circulatory system, improving that flow, but we're also reducing tension and inflammation in those areas. We can place electrical stimulation on the needles as well to relax the muscles and reduce tension.
Right.
And again, just create that balance and harmony. And it's fascinating because even with the limited amount of technology they had, the amount of change they created in the body, whether it's using ear acupuncture, scalp acupuncture, you name it, you see healing happen.
Wow.
Right? So it's really, really neat. But I had a patient in graduate school.
Okay.
And in the clinic, and we were treating this patient for maybe a few weeks. And it's a teaching clinic, so it's like 4 of us in there at one time.
Right.
And we're leaving out in this particular day, and she stops us. She says, "Can I ask you a question?" We were like, "Sure." And she's like, "I want you to be completely honest with me." And I was like, "Definitely." And she was like, "Does acupuncture change your state of mind?" And we were like, "Of course." Right. And she was like, "Well, it's crazy because I haven't taken my depression medication in like 2 weeks, And so it just showed me so much of how the body can heal and change and regenerate with the acupuncture.
So acupuncture can help with depression. I'm assuming can help with anxiety.
Of course, yeah.
That's amazing.
Yeah, I had another patient. I mean, she was so anxious. She couldn't work. She couldn't take care of her kids. And about 10 or 12 treatments, I mean, she was like back to normal, even better, like it never happened.
How long does it normally take to see results?
Each patient varies,
Okay.
but I would say if it's something that's happened that's more acute or recent, anywhere between 8 to 10 treatments, you see a significant shift. If it's something more chronic, I would say between maybe 15 to 20 sessions, you see more of a significant shift.
Okay.
The beautiful thing is the treatments kind of build upon each other.
Right.
And obviously, the more sensitive a patient is, the more shift they may see.
Okay.
And then, there's that 5 to 10% of people are just like, what, I didn't feel anything.
Right.
But usually with anxiety, depression, those types of things, we're able to really calm the mind, reduce the stress and tension in the body,
Right.
and change the tone, right? And that's another thing with chiropractic. And you sat in my chair before and I worked on you.
I did.
And in just 5 minutes, we can change the tone.
Right.
And changing tone you not only see the muscle reduce, but you're calming the nervous system down.
Right.
And that's the other thing, things like breath work, cold plunge, sauna, those things reset the nervous system as well, give it a challenge, but it also helps in reducing tension and stress on the body by allowing the nervous system to kind of recalibrate.
Got it.
So that's why those things help a lot, but we use breathing and those types of things in our sessions because it helps calm the mind, reduce stress, and allow the body to be in a better healing state.
That's amazing. Yeah, I'm a huge proponent of cold plunge, huge proponent of the sauna. I just, after I lift, obviously the next thing I want to talk to you about is foam rolling, because I know that's probably, just having the small, training certification that I have, I know how impactful foam rolling can be on releasing all that built up lactic acid in your tissue. And I know for me personally, when I was going through the really stressful time, biggest thing for me was lifting, foam rolling, and then either cold plunge or sauna. And I feel like that formula just really saved me in a lot of ways. Now, what about cupping? I know that you also specialize in cupping. I personally have never tried it. It's something that I would definitely be open to. I've heard really great results from people that have tried it. What exactly does cupping do for the body?
Yeah. Cupping is a great combination. I use it a lot with acupuncture.
Okay. Together?
Yeah, together or in the muscle work that I do for my patients. But acupuncture helps bring fresh oxygenated blood through those injured tissues. It also helps rinse out toxins because you're bringing that blood flow to the surface. So it opens the pores to release some toxins. It improves circulation. So I know you may have seen the cupping mark some people before.
Yes.
So the darker the circle is, the more stagnant blood and chi in the area. Okay. So by pulling it up through those tissues, now the body has to circulate it through. So it relieves some of that tension, some of the inflammation, pressure, tension in that area, and allows the muscles to relax and then just improve that circulation altogether.
Is it painful?
Usually it's not painful.
Okay.
No. Obviously, the more pressure you put in,
it's probably not the most comfortable.
Yeah, but usually you do it to the tolerance of the patient, right? The goal is not to make it painful.
Right.
So someone can hold you and it be comfortable, or someone can squeeze you till your breath is coming out, right?
Right.
So it's kind of the same idea. It's like the cups, you can, create a suction that's very, very tight, or you can have it loose and not as tight. So.
And then I assume as time goes on, you just work your way up to the suction being a little bit more powerful. Or no, it's not necessary.
No, it's not necessary per se. I would say you're really trying to see when the darkness of the circles reduce, right?
Okay.
That's letting you know that it's, you don't have as much stagnant blood and chi there.
Right.
You're getting better circulation
There's
in that
more
area.
movement.
Exactly. Right. So I would say that would be more so the goal, is to see the circles lighten up in those areas if you're trying to do some type of progression as you're observing the healing process.
Now, have you worked, and this is just more of a personal question, have you worked with a lot of women in your practice that, are coming out of traumatic situations? How does posture play into that, and spinal alignment? How does that all go into mental, physical wellness and health? Because I feel like, if you're physically stressed, you're going to start feeling it, right? Your body starts holding on to that inflammation, stress, whatever you want to call it, and starts, presenting itself in different ways. And so, I'm just curious to know if you've had a lot of women that have opened up to you, patients that have opened up to you about traumatic experiences they've been through and how their body is now showing the signs of that stress, that fight or flight. And, maybe some personal stories on how you've seen them work with you and what the positive outcome has been for them.
Yeah, posture is a huge window to your mind, your spine, everything, right?
Okay.
When you look at someone who is coming out of traumatic experience and they're very tense, right? You usually see a lot of shoulder tension, soreness, achiness there, which may lead to different headaches, whether it's tension headaches, vertex headaches, migraines. So your posture is going to reflect that big time.
Okay.
Also, the rolling forward of the shoulders. Someone who's depressed, right? They're low. They're usually here, right? And someone who's more confident, assertive, they're more here in that power position, right?
Yes.
So yeah, I tell my patients all the time, your posture is a huge reflection of your health overall. And Hippocrates, the father of medicine, he said, in disease, look well to the spine because it tells you a lot, right?
Yes.
It's the kind of the headboard of the body, right? If you have an electrical system, you go to the headboard, and when you have the nervous system, your headboard is your spine because that's where it's protected and it's housed, right? So we also see with patients who have like asthma, chest pain, all those various different things too, they may have ribs that are misaligned, or again, their posture is reflected more so on one side than the other due to scoliosis, which could be more functional or structural.
Where they're more dominant, you mean on one side than the other?
Right, yeah. Whether the muscles are very tight on that side due to repetitive motion, or just scoliosis, the way their spine is developed.
Right.
But when we particularly talk about people who are stressed and depressed, I would say it's more so upper shoulders, neck, headaches, those types of things.
Right.
The muscles in the neck are usually very tight, the SEMs, right? I had a patient who would drive 2-3 hours to LA for work, 2-3 hours back.
There's a lot of people that commute for work.
Yeah.
You know, and in that position, that neutral position with your hips, the arms up here holding the steering wheel, your shoulders are coming up towards your ears. I'm sure, you know, after years of doing long distance travel for work every day, that's gotta do some major wear and tear to the body.
Right. And more so, I would say the stress of being in LA traffic.
Of course.
Right. And so that's what I was getting to. You were talking about an example or a case study of a patient who experienced that.
Right.
And her neck muscles, her upper shoulders, her mid back, like was so tense.
Tight.
It was like a tight board,
right.
you know? Over time, again, I focused more so on the parasympathetic, right? Upper cervical spine, really calming that nervous system down. And we could start to see the shoulders relax. Right? The tension in the neck reduce, those SEMs, those scalene muscles, all of that start to reduce because now her nervous system was able to calm down. Her sleep improved, right? So we know stress is going to affect your circadian rhythm.
Yes.
Right? And that starts to tap into that cortisol. So coming out of a stressful event, whether that's a very harsh relationship, you know, marriage, whatever that may be,
right?
You're going in that fight or flight, and your cortisol is going through the roof.
Spike, yep.
And so, you know, you start to see an imbalance there. So when we look at testing, there's obviously blood tests you can do, look at your AM and PM cortisol levels, but also salivary is another good one.
I did that.
Awesome.
Yeah, I did that. I went through all the good, you know, I tell all my girlfriends that are going through stressful times, not just a divorce, but maybe a death in the family or a loss of a friend, go in and have your normal checkups done, but ask for extra tests, like you said, to test your cortisol levels, because that probably is playing a huge fact into other little health things that you have going on that you may not even know is linked to that.
Right. Yeah.
You know?
And, you know, you have women who are coming out of a divorce, for example, and they're like, I want to get my health together. I want to lose weight. I want to do this, that, and the third.
Yes.
But if they're in that fight or flight and their cortisol is spiked up, it throws off their metabolism, especially
hormones. Does it throw off hormones?
Affects their hormones, right? So looking at a salivary cortisol test will show you in the morning, you should have a spike of cortisol within 30 minutes of waking.
Oh, wow.
Okay. And that should be the peak of your cortisol. You're waking up, you're getting up, right? You're ready for the day, you're ready to seize the day.
Right.
And then throughout the day, that cortisol level should reduce. Now, at the end of the day, you should get a spike of melatonin, right? Which makes you sleepy, and now you're ready to go to sleep. But if you're chronically stressed, some people say, oh, I get my second wind at 10 p.m. or 11 p.m.
It's not healthy.
Right? It's because they're getting another spike of cortisol at night.
I see.
Okay, and that could be they can't shut their brain off because they're so stressed with work and home and finances and all these different things.
Maybe looking at their cell phones.
Looking at cell phones, you know, whatever that may be.
Yeah.
The blue light, and it's spiking cortisol and keeping them up.
Right.
So, but then you have those other people who are pushing the stimulants, right?
Yep.
So it's burning the candle at both ends. And then when they do get up in the morning, they don't get the cortisol awakening response in that first 30 minutes. That cortisol doesn't spike.
I see.
And so then they have to push caffeine or whatever stimulants even harder to try to get that push to get them up in the morning.
Right.
And although they think that they're helping themselves, they're
not.
It's negative reinforcement.
Right.
Right. So ultimately you want to support your adrenals and support your stress organ versus taxing it and burning it at both ends. Right. So with my patients, a lot of them I will do adaptogen herbs, the ashwagandha, the rhodiola.
I was going to ask you about ashwagandha.
Yeah.
I'm on ashwagandha every day.
Excellent.
My adrenals really took a hit with my stress. And how I knew all of this is I went to a naturopath during the divorce process and said, look, I'm not feeling my best. I'm exhausted. I'm in survival mode. What is it that I need to do? Right. And she was the one that did the saliva test, checked, my blood, did extra little tests here and there, and said, we need to get you on a really strict supplementation plan, and also for my sleep. There was a company, it's called PIM, PYM. I highly, highly suggest it. They produce GABA chews.
Nice.
And GABA chews were my saving grace. I would chew those before I'd go to bed at night, or I would drink, a magnesium powder.
Nice.
And it just really helped me with my sleep.
Awesome.
And yeah, adrenals are big, right? I mean, if you're not releasing that and your body is not draining properly, that can definitely cause a lot of health issues down the line.
Exactly. Yeah. And that circadian rhythm is that balance of the cortisol and melatonin that we were talking about.
Right.
Yeah. So resetting your circadian rhythm is really supporting your adrenals, taking out the stimulants, right? Giving you the adaptogen herbs so your body can adapt to that stress.
Right.
Versus you just trying to power through it, pedal to the metal.
Yes.
Right. So yeah, and then obviously your adrenals going to reflect to your hormones, right? So one big thing when you start to look at women who are trying to do fertility.
Yes.
And you have the mother hormone, which is called pregnenolone. And pregnenolone usually goes to DHEA, and DHEA leads to your testosterone and your estrogen.
Right.
Now, if you are in chronic fight or flight and high stress, there's something called pregnenolone steal, where that pregnenolone mother hormone, instead of going to DHEA to your fertility hormones, it's going to go over to cortisol.
That's interesting.
Yes. So if you're in chronic fight or flight, you don't need to reproduce if you're being chased by a tiger.
Right.
So that's the thing. Your body's going to steal that in order to create more cortisol so that you can get through the stressful environment that you're in.
Wow.
So that's why it's so important to manage your stress, right? Not, burn the candle at both ends and take the stimulants, because it's going to throw you out of the other things. Your digestion is going to be off. Your ability to focus and concentrate and multitask, right? Like all these things are going to be affected, because you're in more of a sympathetic fight or flight versus parasympathetic.
More brain fog.
Which, even leads us to another thing, which is more gut health as well.
Yes. Right? And that's actually where I would like to go is talk more about gut health, because I'm really passionate about that. Yeah. I think a lot of women struggle with gut health.
Oh yeah, big time. And one of the big reasons, which is very unfortunate, is birth control. Birth control jacks up your gut. And women are starting on that very early to try and balance hormones. Right. And it's very unfortunate, because then their gut is starting to break down.
Pays the price.
Right. And so then you get leaky gut process happening, where that barrier breaks down, undigested food, proteins, bacteria pass through, activate the immune system, and create systemic inflammation.
Wow.
Okay. Now that is like the open door to autoimmunity.
Right.
And then you have young women who now will then have a higher risk of thyroid, right? Autoimmunity. So hypothyroidism, Hashimoto's is very common, and you'll see that. And it's not a thyroid primary issue, it's an immune system
issue.
And it's coming from the gut. So healing that gut is so important.
Right.
Right.
So are you a big proponent of pre and probiotics? What supplementation would you suggest that somebody take in order to keep their gut flora healthy and regulated?
Yeah, a good healthy pre and probiotic is important, right? Like there's like the EP.4 or EP.4 you can take, everyone can benefit from, right? And probiotics is one of them, okay? But also if you do have that leaky gut process, which all of us at some level probably do
Have it.
because of genetically modified foods, especially gluten, right? And that's the big one. And it's not just a buzzword, it's literally true. You know, you can't process the gluten that is here like you could if you went to Europe, just because of that change in the protein. So if you want to help heal that gut lining, you want to take things like L-glutamine, short chain fatty acids like N-butyrate, you know, those types of things actually help heal the cells of the lining of your gut. Okay. And then obviously things that are going to reduce inflammation. So we talk about turmeric.
You're the one that got me started on that.
Yeah. It's a very powerful anti-inflammatory. Also your omegas, right? Really good fats, which you need, which is going to help with your hormone production and liver, right? But also help lower inflammation. Boswellia is another good anti-inflammatory. And then vitamin D is huge. It helps regulate your immune system, which a lot of people don't know. It's not just for your bones, right? It's also for hormone regulation, which is highly, highly important. Or immune regulation, which is highly important. So getting that vitamin D is key for everyone. So everyone could probably take that because we're indoors most of the time. We don't get enough sun. So taking vitamin D, a good healthy vitamin D, is important.
Now, in regards to vitamins, do you suggest liquid? Do you suggest capsules? Does it really matter what format they come in?
I will say
absorption, is the absorption levels different?
Right. It depends on the bioavailability of them. And frankly, that person's digestive system.
So it's an individual thing.
Yeah, it could be. Like some people may do better with liquids just because they don't like to swallow. Right. But, you know, we say you are what you eat.
It's true.
Which is true with a caveat. You are really what you absorb.
Very true.
Because you can have the healthiest really good diet, but if you do not absorb the nutrients, then it's for naught, right? So, making sure you have optimal digestion is going to be highly important for your ability to process the nutrients that you're taking in. So I would say that's the key, which, you know, another great way is by doing like a IV vitamin therapy, right?
What's your opinion on that? The IVs, because, you know, there's a lot of the hydration room, there's a lot of places around here that are really big on that, and people swear by it. I mean, I've tried it and it's helped me with certain things. Yeah,
definitely. I mean, it's a great way to bypass your digestive tract and get the nutrients in directly
where they need to go.
Yeah, I love it. I do the Myers cocktails myself.
How often are you doing them?
Yeah, obviously depending on schedule, but I would say every 6 to 8 weeks I like to do you know, IV vitamin therapy. A great way to rehydrate, like you talked about, as well as just boosting your body with nutrients. You know, so it's awesome. I feel like things become a little brighter.
Everything becomes clearer, sharper. I mean, that's how I felt after I tried it. It was pretty amazing. Pretty amazing feeling.
It reminds me of like a video game, one of those guys that are fighting, and then they like get one of those little health packs, right? And it just like renews their energy. Like that's what it feels like. You know?
It's amazing. It's really amazing. So in regards to supplementation, what would be your go-to for sleep management? I know we talked a little bit about it, but I'm so passionate about sleep management, stress management, because that's what I educated myself on during my process. And so I really want my viewers to feel confident in some of the advice that you're giving them today. So in regards to sleep management, what are some supplements that you would suggest?
Yeah, first and foremost, I would say looking at the cause of why you may have sleep issues, insomnia, that type of thing. So number one, though, I would say start with an adrenal supplement, Reset that circadian rhythm, your balance between your cortisol and melatonin. You naturally produce melatonin. So Obviously, you can take it to help as a supplement, but that's probably not the cause. It's probably the ratio with your cortisol and melatonin. So you want to balance that by supporting your adrenals, making sure that you're not overdoing the cortisol. And from there, you can see if that stabilizes you.
Right.
If not, you can add in some melatonin. You can also do magnesium. One of the things I like to use with my patients also is valerian. So
I've never heard of valerian.
Yeah, valerian root is a natural relaxer as well.
Okay.
So I will have them kind of cycle on and off like every 3 or 4 days.
Does your body get adjusted to it? Is that way?
Yeah.
Okay.
With your body, with anything, it's going to modulate to.
Right.
And that's why medication or supplementation, whatever, if you're always taking it, the threshold that your body's going to have for it to be as effective is going to
will change.
Exactly.
Eventually you'll plateau.
Exactly.
Almost like with fitness.
Exactly.
Got to change it up like you do with your fitness.
Right. So that's why I usually recommend you don't just go valerian root 30 days straight. You want to 3 or 4 days on, 3 or 4 days off. But again, addressing the reason why, right? So, but yeah, the adrenal, the valerian is great. And then there's another supplement I use through a proprietary blend through standard process that helps just kind of calm the mind. There's people who their mind is just going, they can't shut their brain off to fall asleep.
Right.
And so that supplement in particular is great for that.
Okay.
Yeah. So I'll usually use that. It's called Minchex.
Okay.
And it's great at just kind of calming the mind, almost kind of call it like a little tranquilizer, just to calm the mind down enough for you to be able to fall asleep.
Right.
Yeah.
And is there an amount, I know everyone says you got to get at least your 7 or 8 hours of solid sleep. Do you stand behind that 7 to 8 hour marker, or?
Yeah, I would say on average 6 to 8 hours of sleep, most people
is adequate.
Thrive on. Yeah, for sure. Yeah.
Because I know people in their daily lives are so busy with jobs and kids and
exactly.
Life is really stressful.
Yeah.
So I there's probably people that are going to hear this that go 6 to 8 hours. I'm up all night with my kids. Man, I remember the sleepless nights when I first came home with my daughter. Mm-hmm. My sleep was all over the place. Mm-hmm. I was lucky if I got 4 or 5 hours.
Right. Yeah. I think that's obviously the biggest challenge when you have kids.
When you have children, it's just different.
Yeah. I remember with my son, I was thinking, I'm going to be fine. Like in grad school, I could sleep 4 hours and get up and I'm good.
Right.
But with kids, it's the interrupted
different.
Sleep, right, that gets you.
And that's the hardest.
Right.
Because you finally fall into your REM, as they call it, and then you're being woken up out of that REM. And the biggest thing for me was I couldn't get comfortable enough after I got her back down to then fall back into that REM.
Right.
My sleep after that just felt so superficial. It's like the best way to describe it.
Yeah.
Felt very superficial.
And even if you did start to go back into that REM, they wake up in 2-3 hours. Right.
Yeah.
And so you're back up again. So
yes.
That's the challenge. So again, it's like, what is the cause? But then you have people too who maybe after pregnancy, right? Their bladder can't hold as well, so they're up urinating at night.
Well, and your hormones
or whatever
are all over the place.
Exactly.
What pregnancy does to a woman's body, and then the post-pregnancy is just, it's just crazy.
Yeah.
It's a whole new life experience.
I'm sure.
To say the least.
I'm sure.
But yeah, I feel like sleep is just such a staple of overall quality of life and everything.
Right. It is. I do some natural bodybuilding, and with bodybuilders, they say train, eat, and sleep, right? Like you have to get sleep, and I think oftentimes we don't value it when we're young.
Yes.
Because we can, like I said, you can wake up 4 hours or do an all-nighter and you're like, okay.
Yep.
But that sleep is so, so important. When you get that nice deep REM sleep, you have the release of human growth hormone, which is there to help your body recover and heal. So if you're not getting that, then you're not fully healing.
Right.
So yes, sleep is highly important. And again, addressing the cause of why you're having those issues. So if it is more of an internal stress and tension, things like acupuncture, things like the cold plunges, things like all those other things to help kind of reset your nervous system
Right.
is great.
Breath work.
Breath work.
Even the simplest of things, breath work. Meditation, slapping on some type of meditation app on your phone, right, when you're ready to go to bed.
Yeah.
You know, having some kind of program, late night program, if you're able to. I know there's not a lot of people that are able to. But if you are able to, I know the importance of having just your evening routine.
Exactly, yeah.
You know, and making it as much as you can a priority.
Yeah. Even for your kids, I think, you know, oftentimes parents will sometimes like let their kids stay up later and they go to bed with their kids at like 10 o'clock. And it's like, I don't know how they do that, because if you get them to bed by 8 or 8:30, then like you have time to wind down.
Yes.
You know, so having
and
that
have your
night
little
process,
me time.
Exactly.
Yeah,
yes,
which is important.
So important. Yeah. So that night process at night for your kids as well as yourself, getting away from, we talked about the blue light, getting off the screens, and allowing your body to truly calm down. You know, sometimes I tell my patients too, if they can't turn their brain off, watch the sun go down. Right. And drink some chamomile tea.
I like that.
Right. Yeah. Read versus even watching TV or whatever, tear all the technology off and maybe take a bath, whatever it is, to just really just let your body kind of calm down.
Yes.
You know? So.
In regards to lifting, you know, fitness is a big thing for me. And lifting is great, but it's also hard on the body. What is the biggest supplement that someone can take for recovery? You know, there's a lot of moms out there that are into lifting weights like I am and making that a priority in their day-to-day. And I just know as we get older as women, things get tighter. You start feeling a little bit more stiff. The morning after hurts. You know, some mornings I wake up after a hard lift or doing like a really high intensity class. And I'm like, man, I feel like I'm just getting off horse. You know, and when you're younger, like you said, you can just jump right out of bed and man, you're not feeling it.
Yeah.
But you get in your 40s, your 50s as women and things just feel so much stiffer.
Yeah.
So I know a big thing for me was magnesium. At night, drinking that before I go to bed. But what are some other recovery supplements that women can take or men can take in regards to helping the recovery process after lifting?
Yeah. Well, first and foremost, I will say making sure your macros are set up properly.
Okay.
You know, so I have female clients that I work with that want to do, you know, like health transformations. They want to maybe put on some muscle, those types of things. But sometimes women have a barrier in their mind of, if I eat too much, then I'm going to gain all this weight.
Right.
You know, so I think having that healthy relationship with food and have your macros set up to where you're taking in enough protein so that lean muscle mass can be supported. So you are building muscle.
Right.
That's going to help with your recovery significantly.
Okay.
And then branched chain amino acids are very helpful because it's the breakdown of protein. All right, so you have the macronutrient protein, then you have the micro, which is the amino acid. So taking in the branched chain amino acids, it's already broken down, so your digestive system doesn't have to do that work.
Overworking
it. So it's easier to absorb and start that recovery within the first 30 minutes or hour or so of finishing your workout. It's like a window you have.
Okay.
Also, L-glutamine is also another one. It's really good at helping restore and repair tissue.
Okay.
So it's another supplement you can take. But ultimately, you can't beat just making sure you have proper nutrition and taking in enough of the macros in order to help your body build and grow and recover.
Right. Yeah, no, that's something I've really had to stay on top of, but you know, it's hard sometimes to make sure. I think the biggest thing is making sure you're taking enough protein in.
Yes.
You know, and what I told my clients when I used to train was, don't be afraid of carbs as long as it's good carbs. Right? Don't be afraid of it. You need it. Your body needs it for energy.
Right.
You know?
And for recovery.
Correct.
Right? You have to rebuild muscle and you need the glucose in order to do that. It helps produce ATP, which is going to be the thing that's going to give your body energy to order to metabolically work.
Yes.
So that's the key in understanding that you can always change the amount of carbs you're taking in. So number one, try not to do refined processed carbs as much as possible, but taking a healthy carb, you can modulate that if you want to gain weight or lose weight or whatever the case may be.
Right.
And so that's another thing that I do with my patients is empower them to see, like, okay, I had a week where I lost weight, and then I had a week where I didn't lose that much weight. What happened?
Right.
And you start looking at those cards, and it's like, oh yeah, it was someone's birthday at work, or I had that donut, or I indulged over the weekend. I drank some alcohol, and
there's balance.
There is balance.
You got to find that balance. You got to live. You got to enjoy your life and have your social time with your family and your friends. And it's okay to cheat.
Exactly.
It is, just depends on what your goals are.
And that's the key. It's like, what is your goal?
What's your goal?
And if you know too, like, this is how I empower my clients or my patients is, if you know, hey, today is my birthday, I'm going to have some birthday cake.
Right.
My goal is to have, let's say, 120 grams of carbs per day. This slice of cake is going to be 60 of that.
Right.
So now I eliminate 60 grams of carbs from my other meals, and then I can continue to hit my goal for that day.
Right.
But I can also indulge a bit and have that balance.
Right.
You see?
Yes.
So it's all about knowing how to set your macros and knowing how to modulate them to hit your goal,
right,
but yet still enjoy life in a certain fashion,
right,
and not feel so restricted and so limited, right?
Yeah.
So I did that with one of my clients recently, and she was just like, well, in the next couple of weeks, things might be off. And
Something's coming up.
Well, let's not totally lose your momentum here.
Right.
Let's just say, okay, you're right. You're going to have some cake, or you're going to have some of this or that. So let's subtract that from your other meals to make sure that you're still hitting your goal, so you don't throw yourself all the way off.
Right.
Yeah.
Now, what are some helpful ways of dealing with perimenopause or menopause? There's a lot of women that are like, do I go on hormones? Do I just educate myself and go the natural way? I think that's a really big thing for a lot of women. I mean, just going through it is already an eye-opening experience. Your body changes so much, and it's something that we have to just not fight, but learn how to live with and then, deal with in healthy ways.
Yeah.
So to a woman who finds out through her OBGYN or through a GP that, hey, you're perimenopausal or you're menopausal, what are some things that you've noticed with your own female clients that have helped?
Yeah. Number one, getting the proper testing to see where things are. Right. So you want to have a good amount of metabolic markers to show you where you are. Right. And that gives you an idea of why the changes and what changes are happening in your body to where you can support yourself. Mm-hmm. So a full female hormone panel, right? So you want to look at your estradiol, but you also want to look at your estrone, right? Because menopause for women, estrone is going to be more important. Estradiol is more for reproductive women, right? Okay. So understanding that there's actually 3 estrogens. There's not just one.
I don't think a lot of women know that.
Right. So you want to be able to look at those. Also looking at testosterone for women, their recovery, also maintaining their muscle mass, right? So the 3 things I always stress with my patients that are going in perimenopause and menopause. You want to maintain your bone density, right? Reduce your risk of fractures and things of that nature. Right. You want to maintain your muscle mass and your brain mass. Okay. So you don't want to go into dementia. Right. And you don't want to be super weak and frail. Okay. So you have to stress bone in order to maintain it. Right. You have to stress the muscle in order to maintain it. Right. But you also have to have the proper nutrients. Right. And then also challenging your brain and making sure you're getting good, healthy fat. So this low fat, no fat stuff, like...
throw it out the window.
Yeah, it's a thing of the past. Don't do that, right? Like you saw, they did that in the past, and dementia and Alzheimer's skyrocketed. Right? Your nervous system and your brain is made up of fatty tissue. You need it. Right? Yeah. So even, I think we were earlier talking about statins, right? Yes. Like, you don't want to stop your fat production. You want to make sure things are in balance. And it's more of the ratio, that total to your HDL, and just making sure it's in a healthy place. But yeah, so those are things I really talk about as far as my perimenopausal and menopausal. Also looking at your thyroid, a full thyroid panel, right? Not just your TSH and T4, which most commonly are taken because they're going to give you a medication that's T4, right? But if you have a low functioning thyroid or that's showing up, it could not be just the primary TSH that's going to show up,
Right.
Which is your thyroid stimulating hormone. You want to look at your total T4, but also your free. You want to look at your total T3, but also your free T3 that's floating around and available.
Okay.
And that's important because your T4 is the precursor to your active thyroid hormone, which is T3.
Oh.
That converts from T4 to T3 in your liver.
Interesting.
60% of it does in your liver. So if you have a congested, unhealthy liver, then you're not going to convert as well. Okay. And so you're taking T4 when the issue is not your thyroid producing T4. The issue could be your conversion from T4 to T3, which is in your liver.
Right.
So you need to clean up your liver and make sure your detoxification phase 1 and 2 are working.
Right.
Right. And you can metabolize these hormones well. So let's say you stopped or you don't have that optimal, but then you start taking T4, you're taking an exogenous hormone.
Right.
You can't even properly metabolize it in your liver. So
Right.
now it's just taxing your liver even more. Right. So those things you have to look at. And then also antibodies on your thyroid. A lot of young women are diagnosed with hypothyroidism. And it fluctuates up and down their TSH, their thyroid stimulating hormone, which is how they diagnose hypo and hyper. And the issue is their immune system attacking the thyroid.
The thyroid.
So you have to look at the TPO and the TGB markers, which are antibodies for the thyroid.
Got it.
So young woman, she's taking she's taking birth control.
Right.
It's tearing up her gut. Now she has leaky gut, systemic inflammation. The gluten molecule looks similar to the thyroid cell. So the body attacks gluten and it attacks the thyroid, right? So now the more gluten she eats, the more inflammation kicks up, the more her immune system attacks the thyroid. It slows down the production of, exactly.
Yeah.
So now it's making that thyroid slower. And now you can see why these young women who may have a body type that doesn't even look hypothyroid have Hashimoto's. And you're like, that doesn't make sense.
Right.
You have to look at the antibodies. And then you have to assess the immune system and treat the immune system, not just give them thyroid medication.
Got it. Yeah.
See, so it's looking
finding
at the
doctors
cause.
that aren't quick to put you on these drugs, right?
Right, or more so finding a doctor that's going to look for the cause of why.
The root
Right.
issue.
Exactly, because good medicine is looking at the diagnostics and then applying the proper correction of the lab,
not just putting a Band-Aid
managing
over
the symptom.
a wound.
Exactly. You don't just want to manage the symptom.
Right.
You want to say, okay, like obviously your immune system is overacting, but why?
Why?
Let's look at the gut. Let's look at, right? Like 60% of your immune system's in your gut.
Right.
Right. So making sure your microbiome is good, you don't have a leaky gut process, all those good things are in place. And that's also, going to affect their vaginal flora, all of that, right?
All of it.
So it's so important for women to make sure they're getting the proper testing so that they know. So going into menopause or perimenopause, also looking at that thyroid, looking at your female hormones, looking at also your blood sugar, right? And cortisol levels. Like, how are all these things happening? Because your estrogen can start to go low and you get fatigued, your mood changes, right? The hot flashes, all these various different things.
Not hot flashes. I hear that from a lot of women.
Right.
Yeah.
And there are supplements you can take to help balance that out in the shift of your hormones when that's happening, right? But ultimately, you just want to not exacerbate all of that with all these other things that are going on. And ultimately, your metabolism is going to shift and change due to those hormones as well.
Okay.
So making sure you're looking at all those markers, have a good gut test that's going to look at your gut, make sure you don't have malabsorption, inflammation, overgrowth of bacteria in your gut, all those different things. Like you talked about the cortisol test, salivary test.
Yep.
So these things you can look at and observe and say, all right, like this is a full picture of your metabolism. This is where you're off. Let's support you here. Allow your body to get out of this adaptive state into
Right.
proper physiology.
Right. No, that makes complete sense. You know, I love all of it. And I know that today, a lot of the things that you have said, a lot of the women that are going to be listening to this, they're going to be like, oh, I needed this, you know? And I'm the biggest proponent of be your own advocate, you know?
Yes.
I love doctors. We need them, but be your own advocate.
Yes.
Educate yourself, look into it. You don't have your health, you don't have anything.
Right.
So just educate yourself, be your own advocate. Go into your OBGYN with a list of questions. Go into your GP with a list of questions, you know, and advocate for yourself.
Right. Exactly. Yep. Ask the questions, and if they don't want to answer it, then go to the next person. Right.
Yes.
Like, don't just settle, because you're right. Especially coming out of stressful situations in life, right? Divorce, loss of a family member, you know, kids, all these various different things.
Yeah.
You want to make sure your health is optimal so you can thrive, so you can take care of other people and do the things that you want and need to do.
Right.
And so you're not, again, dwindling yourself down, right?
Yes.
Making sure your cup is full, because you presenting yourself as your best to the world is going to be your best situation.
100%. And then once your cup is full, you can give to others.
Exactly.
And as moms, that's the biggest thing for us.
Yes.
Is making sure that we're on track and we're good so that we can go ahead and be there for our husbands or our kids and first and foremost ourselves.
Right. Exactly.
So,
which moms often put themselves on the back burner.
Yes.
Is,
yes,
know,
we do. We
and
do.
then they're 45, 50 and things start to change and shift, and then they're like, oh my gosh.
Yeah.
You know?
You don't want to wait till the last minute.
Exactly.
You want to be ahead of it.
Right.
Get ahead of it, get a handle on it, and it doesn't hurt to go in for testing even when you feel like you don't need it, because you just never know.
Exactly.
You never know what's going on internally.
Yeah. And if you're not getting answers, you know, again, you talked about, a naturopath, a functional medicine practitioner like myself, we will do the extra testing as well. And we can always communicate with your medical practitioner who has you on medication as well.
Right.
You know, so having a team of doctors to be able to support you is going to be more ideal than, you know, you saying, oh, well, I'm not getting the answers and I just blindly take something, you know, just because I don't know what else to do, but I still feel like crap and there's nothing changing or it's getting worse.
Yes.
Yeah.
Yeah, 100%.
Yeah.
Well, thank you so much for educating all of us on this.
Of course.
I was so excited to have you here today because there were so many questions, like I said, that I personally wanted answers to, and you definitely answered them. So thanks so much. I really appreciate it.
Of course. Thanks for having me. It's been
Of course.
a pleasure.
Anytime. Maybe you'll come back.
Of course. Yeah. If there's another topic that you want to discuss,
Great.
I'm totally down.
Awesome.
Yeah.
Well, thank you.